Welcome to the UNC Health Living Donor Champion Training course. This course will give you some basic information you need to begin the conversations with people about living kidney donation. We hope you find this information helpful. At UNC, we have a dedicated team that works with living donors. Rest assured, your potential donors will be in good hands. Our current donor team consists of the following people: Amy Woodard, Living Donor Nurse Coordinator; Teresa Roberts, Administrative Specialist; Maria Mendez, Financial Coordinator; Mackenzie Schneider, Social Worker; and Elizabeth Vasquez, Independent Living Donor Advocate. All of these team members are dedicated to assisting your donor throughout the process. Our objectives for this session include learning about kidney failure and why it happens, learning about the option of living kidney donation, and learning how to start the conversation with people about considering being a living kidney donor. Let's talk about what the kidneys do. The kidneys filter waste products and excess water from your system. They help control your blood pressure, and they produce hormones your body needs to stay healthy. When you have kidney disease, these functions do not happen as they should. When the kidneys stop working, a person can develop symptoms such as nausea, vomiting, loss of appetite, fatigue, swelling, shortness of breath, and high blood pressure. Eventually, a diagnosis of kidney disease is made, and the doctor discusses treatment options. Dialysis is one type of treatment to consider. The other is transplant. Many times, dialysis is needed as a bridge to transplantation. Here are some statistics about kidney disease and transplant in the United States. There are currently over 600,000 people in this country with diagnosed kidney disease. Of those, approximately 110,000 or more are on the kidney transplant waiting list. Here at UNC, we have over 800 on our kidney transplant list. The average waiting time for a kidney from a deceased donor in North Carolina is 5 to 7 years, depending on blood type. This is one of the many reasons we encourage patients to seek a living kidney donor. There are 4 different living kidney donor options. They are directed, non-directed, blood type incompatible, and paired exchange. Directed donation is when a living donor donates to a specific person of their choosing. Testing is done to make sure they are both blood type and cross-match compatible. Both compatibility tests must be acceptable in order for the living donor to donate directly to the person they choose. Non-directed donation is a bit different. This is when a living donor comes to a transplant center, offers to be a living donor, but has no specific person in mind to donate to. They simply want to donate to anyone in need. In this situation, the same donor evaluation is completed as if they were a direct donor. If they pass the evaluation, they are matched to a person on the wait list, either at UNC or another center if they are part of a donor chain. Blood type incompatible transplant is when a living donor that is not blood type compatible with their intended recipient can still donate to that recipient. However, this involves the recipient having additional testing and receiving additional treatments and medications prior to the surgery. The goal of these medications and treatments is to trick their immune system into not recognizing a different blood type. This kind of transplant can be risky to the recipient, and therefore not every recipient is a candidate for this option. It is something that would need to be discussed more thoroughly with the recipient should it be an option they want to consider. Kidney paired donation is the 4th type of living donation. When a living donor comes forward and they are neither blood type compatible nor cross-match compatible, the only other option they can consider is paired donation. This option involves both the donor and recipient being enrolled in a paired donation registry to search for another pair in the United States they can swap with. The other pair could be another UNC pair or a pair at another center. With this option, the UNC donor and recipient still have their surgeries at UNC, but the donor kidney is shipped to another center, and the kidney we receive for our recipient is shipped to us. The UNC donor and UNC recipient do not have to travel to another center. There are several reasons a living kidney donor is the best option. As I mentioned earlier, there is no wait time. Once the donor has completed their evaluation and been approved to donate, the surgery is scheduled. Also, a kidney from a living donor is going to work better and last longer. A kidney from a living donor will last approximately 15 to 20 years versus 8 to 10 years if it is from a deceased donor. And when a person on the wait list finds a living donor and is transplanted, they come off the wait list, thereby shortening the wait list for those who do not have a living donor. Less people on the wait list shortens the wait time. A potential living donor must be at least 18 years old to be a directed donor. If they wish to be a non-directed donor, they must be 25 or older. The donor has to undergo a thorough medical and psychosocial evaluation, just like recipients do. There are things that rule someone out as a living kidney donor. Things like diabetes, drug use, HIV, obesity, a history of cancer, or autoimmune disorders. A living kidney donor begins their process by answering questions about their medical history. Once that is done, if there are no contraindications identified, we obtain insurance authorization from the recipient's insurance to begin donor testing. The first tests we do are blood type and cross-match. These results let us know if we can proceed with the donor's evaluation. The evaluation tests for a donor include, but are not limited to, lab work, x-rays, CT scans, ultrasounds, and cardiac testing if needed. There are also consultations with a nephrologist, a surgeon, a social worker, a psychologist, and a donor nurse coordinator. After the donor completes all evaluation tests and consults, their results are reviewed by the donor committee. If approved by that committee, the donor can proceed and surgery can be scheduled. Let's talk about the surgery donors go through to have their kidney removed. The typical process is to remove the kidney laparoscopically by 3 small incisions, one at the belly button area and 2 other small incisions on the left or right side of the abdomen, depending on which kidney is removed. Laparoscopic surgery results in a faster recovery, shorter hospital stay, and is less painful for the donor. If laparoscopic surgery is not an option, the other surgery used to remove the kidney is called open surgery. This is very rare and involves making a 6 to 8 inch incision on the side of the body to remove the kidney. The recovery time for this procedure is longer and requires a longer stay in the hospital. After the donor has surgery, they are typically in the hospital for 2 days. They will be on medications for pain. They will be expected to get out of bed and walk around the day after surgery. As soon as they are able to move around easily, they can eat and drink and go to the bathroom, and their pain is well controlled, they will be allowed to leave the hospital. The donor will be required to have a follow-up visit in our clinic with the surgeon approximately 1 week after donation. Other visits will need to be scheduled at 1 month, 6 months, 1 year, and 2 years after donation. However, these may be done remotely or virtually depending on how their recovery is going. The donor will have limitations for several weeks after donation and can expect a full recovery at approximately 10 to 12 weeks after surgery. However, many donors return to work and other activities much sooner than this. This will be determined based on how they are recovering and what work or activities they want to return to. There are lifting restrictions for donors for approximately 12 weeks. There are no dietary restrictions for donors and no restrictions on alcohol intake. We recommend donors follow a healthy, well-balanced diet and see their primary doctor regularly. Living donation does not come without risks. This is a surgery, and it is a surgery this person does not need. The risks for surgery may include bleeding, surgical infection, urinary tract infection, pneumonia, blood clot, hernia, or bowel issues. Death is also a risk, as with any type of surgery. For living donors, that risk is minuscule. Long-term, living kidney donors are at risk of developing high blood pressure and should see their doctor regularly for checkups. There is no difference in life expectancy of a living kidney donor versus the general population. Out-of-pocket costs are also something a living kidney donor will have to consider when deciding if they can donate. While some things are covered by the recipient's insurance, such as evaluation visits, diagnostic tests, surgery, post-surgical care, there are other parts of the process that are not paid for by the recipient's insurance. Things like travel expenses, lodging, lost wages, cost of cancer screenings like colonoscopies, pap smears, and mammograms, and other unrelated medical issues. For example, if during the donor evaluation another medical issue such as an infection is discovered, treatment for that infection is not covered under the donor evaluation. The donor would have to cover that cost with their own insurance or payment method. Living Donor Champion: how you and your loved ones can share your story to find a living donor. Let's start with an obvious question. How will people know that you need a kidney? A, they'll just know. B, the hospital will run an ad about it. C, I or someone I love will have to talk about it. Or D, they can't know. I have to keep it a secret. The correct answer is C, you have to talk about it. Talking about it can involve you or someone on your behalf asking someone to consider donation. If you don't feel comfortable with that, you can raise awareness in general by explaining your illness and that you need a kidney transplant. Letting folks know that a living person could help you by becoming a living kidney donor. Tell people you have information about living donation and know how to point a potential donor in the right direction. You have to share your story. Now that you're ready to share, how do you do it? What do you say? Are there rules guiding what you can and cannot say to potential donors? Are there resources out there to help? Let's start with who can share. Well, you as the person who needs a kidney, or a designated living donor champion. A champion is a person who fights or argues for a cause or on behalf of someone else. A living donor champion is also someone described as an advocate, a proponent, a promoter, a supporter, a defender, or a backer. Who to tell? Everyone, or at least those you are comfortable telling. That can include your family, friends, neighbors, coworkers, religious groups, recreational groups, volunteer or charity groups, and sometimes complete strangers via social media or other outlets. There is no limit on who you can tell. However, there are things to think about. Ask the people you tell to spread the word in their circles. The more folks that know, the better. Even though most living donors donate to someone they know, sometimes acquaintances or strangers offer to donate. If you do share outside of your social network, be careful and keep in mind that many offers to donate don't pan out, and there can also be hidden agendas from those that approach you about donation. You can be creative, like this guy. He asked for permission from his city to stand on the corner with a sign asking for a potential donor for his brother. Wow, what a champion. But please be careful in these situations like this and always ask for permission before advertising in this way. Other safer options could include flyers in businesses in your community or a sign on your car indicating that you're in need of a kidney. More about how to share the story. As we said earlier, talk to people, family, friends, neighbors, coworkers, religious and recreational groups, volunteer and charity groups. You can also use the media like local newspapers, community flyers, church bulletins, email groups, blogs, Facebook or other social media outlets, or a personal website dedicated solely to your search for a living donor. So long as you do not offer payment or financial gain to anyone interested in donating, the sky's the limit. When talking to people, be prepared for questions, assumptions, and misconceptions. Be direct and honest. Be clear and concise with your answers. If you don't know something, say you don't know. Be an active listener and be respectful of any concerns or questions a potential donor may have. At any time, if the conversation is uncomfortable, let the potential donor know they can contact the transplant center to talk to someone and get all their questions answered without committing to the donation process. When using the media, plan what to say in advance. Brainstorm the most appropriate way to approach people, either in person, over the phone, via email, or another way. Approach group or community leaders ahead of time if you're planning to speak up at an event or a location. And always ask for help. You can post bulletins or flyers that allow people to contact you. Give people contact information for our program at the UNC Center for Transplant Care. When talking to others about your need for transplant, you may want to share some information about kidney disease, when you were diagnosed, how you're feeling now, what dialysis is like and how it makes you feel, and how your illness has changed your life. This will make the picture a little more clearer for them as to why you need a transplant. It may also be helpful to share some facts about kidney disease. Over 4,000 people are on the kidney transplant waiting list in North Carolina. The wait for a kidney from a deceased donor is 5 to 7 years. Living kidney donation is quicker and lasts longer. Donors do not need to be blood related, and donors do not need to be the same blood type. It's okay to share that you're hoping for a living donor kidney. You may want to share some basic information about the living donation process, including that the transplant center will evaluate the donor to see if they're healthy enough to donate, that medical costs are covered, and that the risks of donation are small. The first step is for the donor to make a call to the transplant center to start the process. We've created some templates that might help you get started with sharing your story in writing. Please pause the screen at this time to read these prompts. And here's a guide that may help you start an in-person conversation with someone about donation. Again, pause the screen at this time to read these prompts. You might also share things like, dialysis is a huge burden and really disrupts daily life. Or, the doctors say that a kidney transplant from a living donor is his best treatment option. You may also say, did you know that you can live a healthy and complete life with just one kidney? Here are a couple other examples of what you might consider. Please pause the screen to read these prompts. If someone shows interest in donation, you can remind them that this is not something they should agree to on the spot. Encourage them to first talk with their friends, family, and doctor, and explore some helpful resources available online. Also advise them to contact our transplant center for a discussion with our living donor team members. There is also another option out there that can assist you in the quest for a living donor. It is called the Donor app. This app helps patients on the transplant wait list tell their story about organ failure and their need for a transplant. It is a guided template that creates a written story for you based on certain pieces of information that you enter into the app. For those that may struggle on how to start their story, this is a wonderful tool. Studies have shown that patients who spent 5 to 10 minutes using the donor app were over 6 times more likely to have a potential donor come forward. In review, whether you are sharing your story directly or someone is serving as your champion, these are the things you need to do. Prepare your story. Include the facts. Write everything down. Practice having conversations about it. Tell it far and wide and to all that will listen. Make sure to include contact information for the transplant center when sharing your story. It is important for you to know how you can help your living kidney donor if they need assistance. There are some things that you can help pay for, such as travel expenses, lodging expenses, lost wages, and child care costs. However, here are the things you cannot do. You cannot pay someone to donate, pressure anyone into donating, or bribe anyone to donate. Donors cannot financially benefit from living donation. There are financial assistance programs that donors can apply for. The most widely used one is the NLDAC, National Living Donor Assistance Center. This program covers transportation, lost wages, dependent care, and lodging costs for the donor and the donor's caregivers. Eligibility is based on the recipient's household income. The donor and the recipient must complete paperwork and provide proof of income for this program. If a donor wishes to seek assistance from this program, our social worker will assist them with the application. In addition to this program, there are other resources available to you and your potential living kidney donors. This is a list of websites that can offer you and your donors additional information about kidney transplant and living donation. Please pause the screen to review them. I'd like to say thank you to the following programs for sharing their information with UNC to help create this course. Thank you to the National Kidney Foundation, the University of Chicago Transplant, and Johns Hopkins Transplant. This concludes the Living Donor Champion course. We hope that you feel well prepared to advocate for yourself or your loved one in the search for a living kidney donor. Feel free to contact our office with any questions you may have, or have potential donors contact us directly. We are happy to answer any questions. The best ways to contact our team are by visiting our website at uncmedicalcenter.org/livingdonors, or by contacting our donor coordinator by the phone number and email listed here. Thank you and good luck.